All right, let's do this one here.
All right. Which of the following cloning factors is most likely deficient in this patient? Oh, we kind of just talked about this. 25-year-old man presents to ED after sustaining a deep laceration in his arm while cooking. He reports that his bleeding has not stopped despite applying direct pressure. Patient has history of prolonged bleeding after dental procedures. Okay. And a family history of bleeding disorder. Lab results show a normal PT and PTT. Okay. If he has a normal PT and PTT, they love and dental procedures, they love asking about like von Willebrand's, which is 8. So I think, right? Von Willebrand has something to do with 8. And then with I mean, he is male, so and he has the family history of the bleeding disorder. I'm also thinking about um like 7 and 8. Is 7 a choice here? Usually they don't give 7 and 8 together. I don't think so. I see 9, I see 11. And then like factor 5, Leiden, I don't really think so. Factor 2, I've never seen as an answer for anything. And I usually with something, I mean, this also could be I can't think of the disease that's like X-linked. Um, what can I think of it? It's like the royal disease. I just can't think of the name for some reason. Um, but that would also be factor 8, and that could also have a normal PTT time. Because von Willebrand factors, these could have, so it's variable. They don't always give it. But I would go with 8 just based on presentation. Oh,
So
it's okay.
let's see
11.
here. Let's see. Family history of bleeding disorder, normal PTT, deep laceration, factor 9, also hemophilia
Oh, hemophilia is what I couldn't think of.
11.
I've never heard of hemophilia C slash Rosenthal. I mean, it could absolutely be a thing. I just don't know about it.
Yeah, let's see. It is less severe than this. Let's see, laceration. Um, I don't know if I agree with this question either
Okay.
because it is a real thing. Hemophilia
Okay.
C is a real thing, but um, I would more likely think it's hemophilia A.
hmm Yeah, I couldn't think of
Um,
that word, hemophilia.
yeah,
And it
hemophilia
also fits
A.
the picture with von Willebrand's, which I know is not a direct factor 8 like problem, but if it's
Sure,
asked in this way, it's factor 8.
sure, and also,
So,
well, the thing I would say is, I mean, it is fits like a very factor 8 because obviously his bleeding time is increased too. But just remember they usually mention like increased bleeding time for factor
okay.
8 and also increased PTT. But in this kind of history, you're thinking either one von Willebrand's or hemophilia A. Those are the most common. Um,
Okay.
Hemophilia 11, yes, that is a thing. Like hemophilia C is a thing, but that is
Okay.
just so rare compared
Oh,
to
I didn't know
A
that.
and von Willebrand's that
Okay.
you're gonna think it's definitely C is gonna be a way better answer here.
Okay.
Just because of the lab, he's a man, right? Increased bleeding
Yep.
time, increased PTT, all deals with factor 8. Factor 11 is still a part of that PTT like line, right? That's going to
Sure.
increase, but it's not going to be as common. A better answer is definitely C. So I'm going to throw this
Okay.
question out too, but definitely for sure your answer is correct here.
Okay. Or at least the thought process, right? Like that's what we're working on anyway.
Yeah, yeah,
So,
for sure. The thought process is 100% correct, but just
okay,
so
good.
you know that, um also you are correct too on this question.
Okay.
So, but yeah.